Everybody out there in the YouTube universe, Dr. Selinger. Today we're going to be talking about ankle sprains and some treatment for ankle sprains. First, before we do that, I want to explain what a ligament is, because a sprain is an injury to a ligament. We have my friend here, Scully, and the ligaments attach bone to bone. So it's kind of like this band here. A ligament will attach one bone to another bone, and a sprain is an injury to that structure that holds those bones together. Now, an ankle sprain can be graded in 3 grades. Grade 1, let me use this tissue to demonstrate, is when we have micro tearing. It's like this tissue right here. If we had some tearing, small tears in the tissue here, we fall, we overstretch these ligaments, and we have some small tears that occur in the tissue. Grade 1 type sprains usually take 1 to 2 weeks to heal. For a grade 2 type of ankle sprain, we're going to have partial tear, just like how I'm tearing this tissue here, and that would be a grade 2 ankle sprain. Usually takes 6 to 9 weeks to heal. We want to make sure that the person is not putting a lot of weight on the ankle of the foot. They're usually going to be recommended to use crutches. They're going to have a boot or a cast. Grade 3 is if I tore this tissue all the way here. This is a grade 3 ankle sprain, and those usually will require surgery. Prognosis to recover from that type of injury, it really depends on where the injury occurred and the rehab involved, but it's very difficult to heal from a grade 3 ankle sprain. Okay, so the most common type of ankle sprain is a lateral ankle sprain. It's to the ligaments, 3 ligaments here, this in the foot. This is a bone called the fibula. This is a bone called the tibia. This is the calcaneus here. This is your heel. And this is the talus right here, which connects the tibia to the rest of the foot. So 3 ligaments that get injured in that lateral ankle sprain would be the posterior talar fibula ligament, anterior talofibular ligament, and the calcaneal fibula ligament. So those are the 3 ligaments that get injured. This is a lateral ankle sprain. This is common when we roll our foot. There's another type of ankle sprain called a high ankle sprain, and that would be when the ligaments in between the fibula and the tibia get torn. That's what we call the high ankle sprain. We're not going to be discussing treatment for that today as much, but that usually is caused when there's a lot of torquing or tension in the ankle and we have those tears. Very difficult to recover from. So how did you sprain your ankle?
Well, I was just grocery shopping with my son, and I was rushing, doing mom things, and the cart, I was going one way and my leg went the other.
Wow. So you told me before that your ankle kind of rolled this way. We call that a lateral ankle sprain. And what we're going to do today is, because I know you're going to be on your feet a little bit later, we're going to do closed basket weave taping that we're going to do for your ankle. This is going to enable you to support your ankle. I want you to ice your ankle later, 15 minutes on, an hour and a half off. And I want you to rest, lay down, and put your foot and ankle up. Do ice and compress it as well. I'm going to have you scoot down a little bit towards me this way. Perfect. We're going to use this underneath the tape. We want to tape the ankle in a way that's opposite that the ankle rolled. So what we're going to do is have you hold this. This is a piece of tape that I just rolled up, and we're going to have you hold the foot like that. We're going to do 1 anchor in the top here. Then we're going to do 1 here, like this. Now we're taping the opposite way, the direction that we're going in the opposite way. So we're taping around that way. Then what we're going to do is we're going to do a stirrup type of taping right here. Okay, we're going to do a horseshoe taping right here, like this, here. We're going to do another stirrup, starting out here, going medially, coming here, like that. Another horseshoe. Okay. Okay, now we're going to close up this little window that we have right here. Gonna close this up here. Okay, good. Okay, great. I'm gonna have you take this here on the side. We're gonna do figure 8, coming around, up like this, and around like that. A little bit extra support right there. How does that feel?
We're very secure.
Okay, great. And we're gonna make sure all the adhesive from the tape is all on there. Good. Okay, great. All right, so this might last for a day or two. That's okay. It usually takes a couple of weeks to heal. We want to be careful about putting a lot of weight on it. We want to stay away from high impact activities as well for a little while. And if need be, you can come on back and we'll be more than happy to take this up for you again. Okay?
Okay.
Great, Cassie. So it was great to be able to help you today. Be careful at grocery stores. Great to have the honor of treating you today.
Thank you.
And we'll see you soon.